Hi there, I'm here to help you learn about your health. Now, before we get started, just a quick reminder. I'm an AI educator, not a doctor, so it's always super important to talk with your healthcare team before making any changes. Okay, so today we're going to talk about something called exocrine pancreatic insufficiency, or EPI for short. We're going to break it all down in a really simple, clear way.
Have you ever had that confusing feeling where you know you're eating enough, maybe even more than usual, but the number on the scale keeps going down? Or maybe you're just dealing with stomach issues that you can't quite put your finger on. I know it can feel really frustrating and overwhelming, but you're in the right place to get some answers.
So, here's our game plan. We're going to walk through this together step by step. First, we'll talk about symptoms. Then we'll cover what EPI actually is and how doctors figure it out. And then we'll get to the really good stuff, your plan for managing it, and, most importantly, how to live well.
All right, first up, let's tune in and listen to what your body might be trying to tell you. These signs can feel a bit random, but they're actually all important clues.
You know, all of these signs are actually connected. It all comes down to one thing. Your body isn't breaking down food the way it's supposed to, especially fats. And when that happens, you can lose weight without trying, have some, well, unpleasant changes in the bathroom, and feel really bloated. It makes sense, right? If you're not getting the fuel from your food, you're going to feel totally wiped out.
And here's another piece of the puzzle. Some vitamins, specifically A, D, E, and K, are what we call fat-soluble. They need to hitch a ride with fat to get absorbed into your body. So if your body isn't absorbing fat, it can't absorb these super important vitamins either.
Okay, so we've seen the clues on the outside. Now let's take a peek at what's actually going on inside your body to cause all this. I promise we'll keep it simple. So, what in the world is EPI? Well, basically, it's when your pancreas, which is a little organ that sits behind your stomach, isn't making enough of these things called enzymes. You can think of enzymes as tiny little helpers that chop up your food into tiny pieces so your body can use it.
Here's a really easy way to picture it. Imagine your pancreas is a little factory. Its whole job is to make and send out these little workers, the enzymes, to digest your food. But with EPI, the factory's production line has slowed down. It's not sending out enough workers to get the job done. So the food just kind of passes through without being fully broken down. Does that make sense so far?
So you might be wondering, well, why would the pancreas slow down? There are a few different reasons. Sometimes it's from long-term swelling called pancreatitis. Other times it could be related to conditions like cystic fibrosis, or maybe after a surgery. The most important thing to know is that your doctor is the one who will connect the dots and figure out the specific reason for you.
Okay, so we know what it is and what might cause it. But how does your doctor find out for sure? Well, the good news is the process is usually really straightforward. Yep, the main way to check for this is a simple stool test. The fancy name is a fecal elastase 1 test, but all it does is measure how many of those little enzyme workers are showing up. It's a simple test that gives your doctor a really clear picture of what's going on.
And the results are pretty easy to understand. If the number is below 100, that's a pretty strong sign that it's EPI. If it's somewhere between 100 and 200, it's a possibility, and your doctor will look at that number along with your symptoms to make a decision.
Okay, now for the most important part. The part where you get to start feeling better. Once you know what's going on, you can start a plan to take back control. And let me tell you, the plan works really, really well.
Your management plan is like a simple three-legged stool. The first leg is taking pills to replace those missing enzymes. The second is making a few tweaks to your diet. And the third is just making sure your body is getting all the vitamins it needs. That's it.
Now, if you remember one thing from our chat today, please let it be this. You have to take your enzyme pills, they're called PERT, with the very first bite of every meal and every snack. This lets the enzymes mix right in with the food from the get-go so they can do their job properly, just like your body was designed to do.
When you get your prescription, you'll see a big number on the bottle, like 40,000 or 50,000. Don't let that number intimidate you. It's just a way of measuring the strength of the enzyme that digests fat. Your doctor will work with you to find the Goldilocks dose, the one that's just right for you. All right, let's talk about food. This might sound a little backward, but a super low-fat diet is actually not what you want. Remember, you need some fat to get those important vitamins. So the goal is a healthy, moderate amount of fat, but spread out over 4, 5, or even 6 smaller meals throughout the day. This just makes the job way easier on your digestive system.
Because that's the whole point of this, isn't it? Not just managing, but living well. EPI is a long-term condition, so the focus is all about your long-term health and feeling good.
Think of this as your regular team check-in with your doctor. They'll keep an eye on your weight to make sure you're getting enough fuel from your food. They'll ask about how things are going in the bathroom to help fine-tune your enzyme dose. About once a year, they'll check your vitamin levels. And because vitamin D is so crucial for bone health, they'll check on your bones every couple of years too.
And finally, there are things you can do every single day to give your pancreas a helping hand. Quitting smoking and stopping alcohol can really help protect your pancreas from any more stress. And of course, staying active is just amazing for everything: your appetite, your strength, and your mood.
I know we've covered a lot of ground, so I want to end with the single most important message of all. Let's talk about the good news.
And that's the bottom line. With the right plan in place, the enzymes, the right foods, the vitamins, the outlook is fantastic. Your symptoms should get so much better, and you can get back to enjoying a really, really great quality of life.
Just remember, you have a clear path forward. Your treatment plan. That's the key. It's the key that unlocks the door to feeling like yourself again and to living a full, happy, and healthy life. So, I'll leave you with this question to think about. It doesn't have to be a giant leap. It can be something tiny. What's one small step you can take today to start on this journey toward feeling better?